Welcome to the first video in the George Washington University School of Nursing's policy series. I am Dr. Jean Johnson, founding dean of the nursing school, and today we are discussing the Affordable Care Act. The Affordable Care Act will allow students and young people to stay on their parents' insurance until the age 26. Denying people because of a pre-existing condition is not allowed. There will be an expansion of the Medicaid program in terms of eligibility criteria. There will also be some tax benefits to employers to offer health insurance, and probably one of the issues that has been receiving today the most attention has been the establishment and enrollment of people through health exchanges, so that people who aren't covered by health insurance can go to an exchange in their state and enroll in an insurance policy. And these insurance exchanges also help people understand if they will be able to get a subsidy to help pay for the insurance, or not. But the health insurance exchanges are big. Access to care, one of the things that we know in healthcare is that when people aren't insured, they tend to put off getting routine healthcare and screening exams. And oftentimes, if they have an illness, they will go to an emergency room, but it's when a disease has progressed. And that is not a good situation. And so adding 32 million people to a health system is really going to challenge our system, because these are folks that did not have primary care providers, did not have a system of care, and we have to figure out how to really have them come into the system and provide the best care possible. Scope of practice for nursing is really critical, and it has to do with really meeting the needs of what we had talked about, the 32 million additional people who will enter a system of care. Nurse practitioners have been known to provide a very high quality of care, of primary care, and are a very viable source of meeting the needs of those 32 million people. But some states have restrictions on what nurse practitioners are allowed to do. These restrictions have been implemented primarily through pressure from medical groups, and yet nurse practitioners keep, working to be able to practice to the full extent of their license. And this is just going to be necessary because many states that have the greatest need have the most restrictions. And there are 57,000 underserved, primary care shortage areas in this country. And we really need to have those, areas have nurse practitioners, PAs, or someone, family physicians. But what we know is that, the number of physicians who are willing to go to underserved areas has decreased, but nurse practitioners still have a very, very large commitment to primary care. Would also like to say in terms of full scope of practice that it's not just the nurse practitioners that we're concerned about, but also registered nurses. Registered nurses need to play a bigger part in our healthcare system, and particularly in the primary care system, because they can provide significant amounts of education, take on some of the tasks that physicians and nurse practitioners have typically taken on, so that we can really expand that primary care network for those 32 million people. In the previous question, I had really put forward an advocacy position for scope of practice, for nurse practitioners to practice to the full extent of their license, and also RNs. But interprofessional practice is really critical in our health system. And one of the reasons is that we go beyond just one-to-one patient care. We have to now be looking much more at how we take care of populations of people. so that we can deploy our workforce in a way that makes the most sense. And this has to include physicians and nurse practitioners and physician assistants and nurses and a whole array of people, social workers, physical therapists. We've got to be able to organize our health system, not so much that, we are only providing one-on-one care, but we are providing one-on-one care plus care for a designated population, whether that population is defined by a specific illness or a specific geographic region. I think the providers needed to be working with patients in a way that has not been traditional. There's still, somewhat of a hierarchical, authoritarian approach to working with patients that providers know best and that patients need to comply or adhere, to treatment plans. And there's been a lot more attention paid to the whole notion of patient engagement. But we have to make sure that it's not just new terms for us expecting patients to do what it is that we're doing, but really understand that patient engagement means that patients are driving the decision making about their care. We will help them with their decision making, but they are the full source of control of their health care. If they should decide, that they don't want to, or if they cannot take, ownership of their care, then certainly, we make accommodations to that. But working with patients in a new way is going to be really important. We also have to understand that patients are being better self-educated about their diseases and their health. There are lots of apps that they can go to, websites that they can go to for information, and then they come to a provider and say, I was just reading about such and such, and I think that this is my problem, or this is what I want to do, and can you help me do that? And we as providers need to be really open to that and welcome, the fact that people will come to us and, with good questions, with knowledge, and, expecting, that they will be in charge of their health care. We also have to think differently about how we organize care and be very willing, to work with patients in groups, create support groups for people with diabetes or with congestive heart failure or arthritis or whatever, the issue may be, because we know that those are effective ways of providing support. And also using social media. We are barely scratching the surface with social media in terms of understanding how to support our patients. We're getting much better at using email to communicate, with patients, but we really have to be using and looking at the opportunities with social media. As a nurse educator, I am very cognizant of the fact that we have to be teaching our students about the Affordable Care Act. We have to be teaching them, what it entails, what kinds of information they may need to be giving their patients, and how it's going to affect us as providers of care. There are a lot of stipulations in the Affordable Care Act that relate to quality of care. And we need to know what those are. We need to be leaders in improving the quality of care. And, we've got to teach our students to do that. That's our responsibility. In closing, essentially, the Affordable Care Act is major landmark legislation. Whether it's called Affordable Care or Obamacare, it will go down in history as being as powerful as Medicare and Medicaid. And it's going to have a huge impact, I think, on the health of our country and of a population that really needs to have access to adequate care.